This is our daily ENT, and this is the oral probiotic that I showed you. It kills a germ called strep mutans. Strep mutans is what causes gum disease and decay. Well, there's another streptococcus that causes lung infections and sinus infections, and it's called strep pyogenes. And the daily ENT helps that. An interesting story, we have a little patient who has Down syndrome, and since his mom's been giving him these, he's been off of antibiotics now for about 7 months, I guess, which he was on antibiotics once a month before that. So what this does, this just recolonizes the healthy stuff. It's not an antibiotic. It totally helps your body do what your body's supposed to do. It's healthy bacteria that crowd out the unhealthy bacteria. And that's what any kind of probiotic does. So our goal today is to prevent sickness and to find the cause and not just treat the symptom. It's just so easy to just look at that downstream problem. We want to move upstream. We want to get things healthy before the problem starts, and we want to make healthy, informed decisions. Well, these are kind of three of my heroes. They've been trying to figure it out. The first guy is Dr. Semmelweis. You all know I talked about him last time. He's the guy that worked in the maternity ward and recommended that people wash their hands. And as a result, he got put into the insane asylum back in the 1850s. Well, Louis Pasteur, of course, came out with the germ theory right after that. And he said, oh no, there's a reason to wash your hands. There's germs around. Well, then Dr. Beauchamp he talked to Louis, and he's like, no, it's not just the germ. And they had a war for most of their life. He said, it's not the germ, it's the field. In other words, it's remaining a healthy host so that the germ doesn't affect you. And so on Louis Pasteur's deathbed, he said, the germ is nothing, the field is everything. And that's what we're talking about today. The field, in other words, your body. If your body is resistant, if your body is healthy, rested, hydrated, nourished, then it doesn't matter if you're around that person on the airplane that's sneezing on you. You're not going to get sick. If the germ was everything, then if somebody walked in here and they had a cough, we would all get it. It wouldn't matter. We'd all get it. But, someone can come in and start sneezing on everybody, and a few people are going to get it. But a few people are not going to get it. Those people have a healthy field. So that's what we want. The germ is nothing. The field is everything. Field, as if your body. That was, the host, a healthy host. And that's exactly what we want. We want a healthy host. We want to be able to have our bodies process those toxins, have our bodies ward off those germs. That's the point. So hopefully I didn't overwhelm you. My goal has been to inspire you. And if there's any time you want to just come talk to me, I will, be glad to tell you anything I've learned and help you with any problem. A real emerging area in medicine I'm very interested in is called preconception medicine, and that's helping young women get healthy before they decide to get pregnant. As you saw, many of these persistent organic pollutants cause birth defects, and if you know anything about autism or just all of these things that are on the rise, I think it has a lot to do with making our bodies healthier so that these toxins don't affect us genetically. So anyway, that's all I have. Thank you all so much.